Vitamin D, also known as the sunshine vitamin, is a crucial nutrient for maintaining good health. It plays a vital role in calcium and phosphorus absorption, bone health, immune function, and a range of other bodily functions. Despite its importance, many people do not get enough of this vitamin, and deficiencies are common in many parts of the world. In this video, we'll explore everything you need to know about vitamin D, including its functions, sources, recommended intake, deficiency symptoms, and health benefits. We'll also dive into the latest research on this vital nutrient, so you can make informed decisions about your health. Part 1. What is vitamin D? Vitamin D is a fat-soluble vitamin that is essential for good health. There are two main forms of vitamin D, vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. Vitamin D2 is found in plants, while vitamin D3 is produced in the skin when exposed to sunlight. Both forms are converted to an active hormone called calcitriol, which regulates calcium and phosphorus absorption in the gut and helps maintain healthy bones. Vitamin D also plays a crucial role in immune function, cell growth, and the prevention of chronic diseases such as cancer, diabetes, and cardiovascular disease. Part 2. Sources of vitamin D. The best source of vitamin D is sunlight. When the skin is exposed to sunlight, it produces vitamin D3, which can then be converted to calcitriol. However, the amount of vitamin D produced by the skin depends on several factors, including the time of day, season, latitude, skin pigmentation, and use of sunscreen. Food sources of vitamin D include fatty fish such as salmon, mackerel, and tuna, as well as fortified foods such as milk, cereal, and orange juice. However, it can be difficult to get enough vitamin D from food alone, especially for those with limited sun exposure. Part 3. Recommended intake of vitamin D. The recommended intake of vitamin D varies depending on age, sex, and other factors. In the United States, the recommended daily intake of vitamin D is 600 to 800 international units per day for adults and children over the age of 1. However, some experts suggest that higher doses may be needed to maintain optimal health, especially for those who are deficient or have limited sun exposure. For example, the Endocrine Society recommends a daily intake of 1,500 to 2,000 U per day for adults who are at risk of deficiency. Part 4. Deficiency symptoms. Vitamin D deficiency is a common problem, especially in areas with limited sun exposure or for those who do not consume enough vitamin D-rich foods. Deficiency can lead to a range of health problems, including weakened bones, muscle weakness, fatigue, and an increased risk of chronic diseases. Symptoms of vitamin D deficiency can include bone pain or tenderness, muscle weakness, fatigue, depression, impaired wound healing, increased susceptibility to infections. Part 5. Health benefits of vitamin D. Vitamin D plays a crucial role in maintaining good health, and research has linked adequate vitamin D intake to a range of health benefits. Here are some of the key benefits of vitamin D. Bone health. Vitamin D is essential for healthy bones, as it helps the body absorb calcium and phosphorus. Adequate vitamin D intake can reduce the risk of fractures and osteoporosis. Immune function. Vitamin D plays a crucial role in immune function, helping to prevent infections and reducing inflammation. Cardiovascular health. Studies have linked adequate vitamin D intake to a lower risk of cardiovascular disease, including hypertension, heart attack and stroke. Cancer prevention. Research has suggested that vitamin D may have a protective effect against certain types of cancer, including colon, breast, and prostate cancer. Diabetes prevention. Adequate vitamin D intake may help prevent type 2 diabetes by improving insulin sensitivity and glucose metabolism. Mental health. Some studies have linked low vitamin D levels to an increased risk of depression and other mood disorders. Part 6. Latest research on vitamin D. There has been a lot of research in recent years on the health benefits of vitamin D, and new findings are emerging all the time. Here are some of the latest research findings on this vital nutrient. COVID-19. Studies have suggested that vitamin D may play a role in preventing and treating COVID-19. One study found that hospitalized COVID-19 patients who received high-dose vitamin D supplements had a lower risk of mortality compared to those who did not receive the supplements. Autoimmune disease. Some studies have suggested that vitamin D may help prevent or treat autoimmune diseases such as multiple sclerosis, rheumatoid arthritis, and lupus by regulating immune function. Pregnancy. Adequate vitamin D intake during pregnancy may help prevent complications such as preeclampsia and gestational diabetes, as well as promote healthy fetal development. Cognitive function. Some studies have linked low vitamin D levels to an increased risk of cognitive decline and dementia in older adults. Athletic performance. Some research has suggested that vitamin D may improve athletic performance by enhancing muscle strength and reducing the risk of injury. Part 7. Conclusion. Vitamin D is a vital nutrient that plays a crucial role in maintaining good health. It is essential for bone health, immune function, and the prevention of chronic diseases such as cancer, diabetes, and cardiovascular disease. While sunlight is the best source of vitamin D, it can be difficult to get enough from food alone, especially for those with limited sun exposure. Adequate vitamin D intake is important for everyone, but especially for those who are at risk of deficiency. If you think you may be deficient in vitamin D, talk to your doctor about getting your levels checked and consider increasing your intake through supplements or food sources. Please check out the links in the description below and subscribe to keep updated on our latest posts.